Hello, my name is Tasha Wendel, and I'm the lead author on the article in the Journal of Dental Hygiene titled Use of Dental Radiographs for Calculus Detection Post-Non-Surgical Periodontal Therapy, a scoping review. This research was inspired by my roles as both a clinician and an educator who teaches radiology. In clinical practice, I worked in offices where post-operative radiographs were taken following scaling and root planing to check for residual calculus. However, this was not something I was formally taught in my education. When I brought this up in an academic setting, I was encouraged to ensure that any clinical or educational practice we adopt should be evidence-based, and that question led directly to this research. As we began reviewing the literature, it quickly became apparent that while calculus detection and removal are widely studied, the specific use of radiographs for detecting residual calculus after non-surgical periodontal therapy is largely underrepresented in the research. Despite radiographs being a routine diagnostic tool, there was very limited evidence addressing whether or how they should be used in this context. This scoping review examined the existing literature on calculus detection and removal with particular attention to whether radiographs are addressed as a diagnostic aid. We reviewed nearly 60 studies and found that while many technologies and techniques are explored, only a very small number of studies directly mention radiographs for calculus detection. This research matters to dental hygienists because we are deeply involved in periodontal assessment, radiographic decision-making, and patient safety. Our findings in this research highlight a gap in the literature, reinforcing the need for research-based guidance, especially as new tools like AI-assisted radiographic analysis become more widely used. This review also has implications for dental hygiene education, helping ensure that what we teach students aligns with evidence-based practice rather than tradition alone. I would like to acknowledge my co-authors for their help in this article, and I encourage you to read the full article in the Journal of Dental Hygiene to explore our findings, identified gaps, and future directions for periodontal imaging and clinical practice. Enjoy the article.